All right. In that case, I want to welcome everyone to this co-hosted seminar with the Global Strategy Lab and the Dudley Institute for Global Health Research. Before we get started, I would like to give a land acknowledgement. As this is a hybrid event, some participants are on different territories, so please do take time and space to give thanks and gratitude and respect to the land that you're currently living on. I'm here today on York University campus in Toronto, which is situated in the traditional territorial area known as Takaranto, and we acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. We also acknowledge this as the traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. It's a territory that is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Now, today we are gathered to speak about tobacco and specifically gender differences in tobacco smoking. I want to also acknowledge tobacco being traditionally in this area for many peoples a sacred plant with many traditional uses that after colonization was commercialized, commodified, turned into products like pre-rolled cigarettes, which became highly prevalent around the world, heavily marketed and distributed by transnational tobacco corporations. And really that's what brings us to the modern day and thinking about what we know has always been a highly gendered behavior. In fact, tobacco companies knew this back in the day when over half of people in industrialized countries started using tobacco, specifically cigarettes, that women were not smoking as much as men and started gender-targeted marketing campaigns to make sure that women would actually consume as many cigarettes as men do, just purely for the bottom line. So tobacco companies know, tobacco control researchers know that tobacco use is a highly gendered behavior, and yet often this is an overlooked area in research. And in fact, some of the researchers that we'll see highlighted today have put out a new publication in the Tobacco Control Journal, which was actually just released today, highlighting the fact that this is a highly under-researched area, that most tobacco control research is not systematically evaluating the impacts of gender on tobacco control measures, and there needs to be much more rigorous research done in this area. So hopefully we're going to put that link in the chat. Please do check out this publication, again, out this morning, just highlighting the fact that we need to be talking about these issues much more. There needs to be a lot more research. And with that, I will introduce our two excellent speakers that we have today, some up-and-coming researchers, starting with Tina Nanyangwe-Moyo, who is a Postdoctoral Research Fellow at the Global Strategy Lab's Global Legal Epidemiology Research Team, where she generates scientific evidence to inform global health policies. Her primary research focuses on evaluating global tobacco control policies, and particularly the WHO Framework Convention on Tobacco Control and its impact on population health. Previously, her work centered on the implementation science in maternal and adolescent health and HIV prevention and treatment in Sub-Saharan Africa, evaluating policy effectiveness and equitable access to services. We'll also be hearing from Mehdi Hassan Russell, who is a data analyst with the Global Strategy Lab, also with the Global Legal Epidemiology Research Team, with a current focus on tobacco control. His interests revolve around health economics and health policy to enhance population health and economic well-being through data-driven insights. He employs theories and statistical methods along with econometric models to dissect both aggregated data and disaggregated microdata to unravel complex issues in an accessible manner. So with that introduction, I will pass it over to Tina and Mehdi to take us through today's presentation.
Thank you so much, Matthew, for that introduction. And good afternoon, everyone. It's kind of morning where I am, but good afternoon. So, and thank you really for joining us for this webinar today. Mehdi and I are really excited to share a sneak peek into our upcoming research paper, which is currently under review at the BMJ Global Health Journal. So you might also be excited to know that this is the very first public presentation of our findings, and we are delighted to offer these early insights into a study that we believe really fills a very critical gap in global tobacco control research. So, as you will see, our research findings raise important questions around cultural and regional dynamics that have shaped tobacco use. And also, they really invigorate what questions around what this means for policy. So our study takes a deep dive into gender differences in smoking intensity, as you can read. And we are looking at not just who smokes, but how much they smoke across 172 countries. So let's go ahead. So just to give context, this year, 2025, marks 20 years since the launch of the WHO Framework Convention on Tobacco Control, which is a landmark treaty that has shaped and reshaped tobacco control around the world. And yet today, cigarette smoking remains the leading cause of preventable disease and death globally, and really accounts for about 8 million deaths per year, which is really substantial. And although attention in global tobacco control has really been paid to reducing overall prevalence, focusing mainly on how many people smoke question, we argue that prevalence alone does not, I see a question. Yeah, prevalence alone does not really tell us the full story about the tobacco epidemic. And we think that we need to go beyond our prevalence in exploring how much people smoke as they start, once they start smoking, as this is a very fundamental question. So, and we know this really does matter for public health, for epidemiology, because cigarette smoking, which we define as the number of cigarettes smoked per day by current smokers, is a dose-dependent driver of disease. And so even according to the CDC, they say that smoking harms not just the lungs, but almost all the entire organs of the body. And still we see that this variable, smoking intensity, is quite underexplored. So, what is even more surprising and even concerning for us is that the data that collects tobacco use prevalence largely ignores gender differences in daily cigarette consumption, which is a big issue. And we're glad to share that our study addresses just this gap. And even more importantly, there is a general consensus that gender does influence health behaviors in more powerful ways. Yet, according to our knowledge, as we are conducting this study, we noticed that there hasn't been any study that has empirically analyzed gender smoking intensity across countries until this study. So to address this gap, our study was guided by two important objectives. So first, we sought to quantify the gender differences in smoking intensity among current smokers in 172 countries, and also try to probe and explore some of the potential drivers of these differences to help us explain why men and women smoke different quantities of cigarettes across different countries. So what did we do? I'll pass the mic to Mehedi so he can elaborate more on the different methods and analytical strategies that we employed to conduct this study. Mehedi, over to you.
Thanks, Tina, and hello, everyone. I will give an overview of the data collection and analysis methods we used in this study. So I start with our data collection methods. We conducted a systematic search for the most recent national surveys to find gender disaggregated data on the number of cigarettes smoked each day, which is smoking intensity. And we had to operationalize gender using a binary approach of men or women due to limitations in country survey data collection method. So we collected the smoking intensity data for 172 countries within a 22-year period between 2000 and 2022, which covers over 97% of the world's population, with at least 89% population from each region. And our gendered smoking intensity data are population-weighted survey estimates that more precisely estimate the true national averages. And these data were collected from 41 different types of nationally representative surveys administered in countries, of which the three most common types were the STEPS survey, the Global Adult Tobacco Survey, and the Demographic and Health Survey. And these three types of surveys contributed data for a total of 123 countries. And we gathered the smoking intensity data separately for daily smokers and for current smokers, including both daily and occasional smokers. But we preferentially present data for current smokers whenever both data were available for the same country. Similarly, we collected data separately for consumption of manufactured cigarettes and for all cigarettes, including both manufactured and hand-rolled cigarettes, but we preferentially present data for manufactured cigarettes, again, whenever both data were available for the same country. Also, to mention that our dataset contains data for men and women smokers aged 15 and above, but their minimum and maximum age brackets vary across country-level surveys. And now, as you already know, that our primary variable of interest is gender differences in smoking intensity, which we measured by the smoking intensity ratio of men to women's average number of cigarette consumption per day. And similar to an odds ratio, this smoking intensity ratio of greater than 1 indicates that men smoked more cigarettes per day than women smoked. And it's the opposite when the smoking intensity ratio remains between 0 and 1, where 1 indicates an equal smoking intensity between men and women. So to understand which country-level factors were associated with gender differences in smoking intensity, we compiled 5 variables based on a structured and relevant literature review. We first used region as a categorical variable, referring to 7 regions based on the World Bank regional classification of countries. Then, as a measure of countries' overall level of economic prosperity, we used GDP per capita, adjusted for purchasing power parity in 2017 constant US dollar. And next, we used religion as a categorical variable with 9 components to include countries' most common religious affiliation. We use this variable as the best available internationally comparable proxy for measuring the country-level effect, country-level cultural effect on smoking, and not as a religiosity itself on tobacco use. And finally, as measures of gender inequities within countries, we explored the use of 2 different variables. The first was the mean years of schooling ratio between men and women aged 25 and older, which we calculated using data from the 2015 UNDP Human Development Reports. And next, we used the ratio of the ILO estimated labor force participation rates of men and women aged 15 and older in 2015. Next slide, please. And we began our data analysis with statistical comparisons of gender differences in smoking intensity, primarily across countries and regions. And we then utilized the ordinary least squares regression models to estimate the association between the smoking intensity ratio and the 5 country-level factors, as already explained. Here, I just want to add that we used log transform GDP per capita and used the interaction term between region and religion to recognize the fact that cultural norms may vary by region. Also, from our two measures of gender inequity, we use the mean years of schooling ratio in our primary regression model, as it was determined to be the most predictive covariate of the two from our bivariate regression results. And we alternately included the labor force participation rate ratio in our sensitivity analysis. And further, and to add that for the categorical variables in the regression models, we selected reference groups based on the criteria of the most frequent category. As accordingly, we use Sub-Saharan Africa as the base category for the region, and Catholic as the base category for religion. Also, the base category for the interaction term is the Sub-Saharan African region's Catholic religion component. With this base category, the results of the other components of respective categorical variables were compared, as you will be seeing this in the key findings. And to validate our results, we conducted 24 sensitivity analysis and robustness checks with 6 different regression models on the full datasets and on the 3 sub-datasets for daily cigarette smokers, daily manufactured cigarette smokers, and for current cigarette smokers. We also conducted a post-estimation test that ensured the validity of all regression models. And I pause here. Now it's over to you, Tina.
Thank you so much, Mehedi. Let's look at the key findings, and we can start with the global picture. Really, across the 172 countries that we studied, we found that men who are current smokers actually consume an average of 11.7 cigarettes per day compared to 8.6 among women. And in terms of cigarette smoking intensity ratio, on a global scale, men consume 58% as much as women, which is reflected in an average smoking intensity ratio of 1.58. Now, as Mehedi just told us, a smoking intensity ratio of 1 would mean that men and women smoke the same amount, and that greater than 1 means that men smoke more. So this global average of 1.58 really signals a substantial gender gap. And what's really striking, like for us, are the variations that we found behind these averages, and because they do tell us a deeper story. So when we broke it down by region, we found the widest differences were in South Asia, where men smoke nearly 3 times as many cigarettes as women. And as you can see on the graph. And also on the contrary, we found that the smallest gender differences were in North America and Latin America and the Caribbean, where the smoking intensity ratio were hovering around 1.1 to 1.2 respectively. And so to us, even though the global picture is one where, like everyone knows, smoking is more among men than men. This finding to us really challenges the idea that this gap is the same everywhere. The gap is really highly contextual. And if we really try to zoom into the different smoking intensity ratios at country level, our results indicate that in countries, for example, Oman, somewhere there, and men actually smoke seven times more than women, which is really a staggering difference with women. And in countries like Bangladesh and also Benin over there, the smoking intensity ratios were also pretty high, exceeding 6. So men smoke more than 6 times as many cigarettes as women. And by contrast, when we look at countries like Sweden, Guyana, Chile, and also the UK, the smoking intensity ratios there were just around 1, which indicates near parity in daily cigarette consumption between men and women. And in an even more unexpected finding, we see that in 18 countries, including Haiti and Guinea, women actually reported smoking more cigarettes than men. To us, in our own interpretation, this could either be an effect of real behavioral differences or some compositional reporting effects where, for example, women who admit to smoking in these settings actually are more regular users, and while men in these same settings may include more of those that are only occasional smokers. And another stark finding that we would have probably missed if we only focused on prevalence is that ratio across countries varied by GDP per capita. And I just want you to really pay attention when I say varied by GDP per capita, as you are going to understand momentarily. So as you can see, we see that smoking intensity ratio here falls as GDP increases. So GDP is going there and cigarette intensity is over there. So more countries, for example, in Sub-Saharan Africa, you can see in orange dots, where had more cigarette intensity differences, like beyond 1 over there. And more countries, for example, in the UK, in the UK or Europe, in pink dots here, had cigarette intensity that was below 2. That also shows us a lot about what is happening in these regions. So we also went ahead to probing some of the factors that are actually associated with these differences. So as Mehed mentioned again, in our regression model, we tested 5 potential drivers or predictors of gender smoking intensity. So you can see them in bold on the table. So one finding that really surprised us was that when we adjusted our model for region and religion or cultural factors, that we used religion as a proxy, is that neither wealth, which is GDP, and nor gender smoking intensity or gender inequity had a statistically significant association with the gender smoking intensity. And which is to say, being a rich or poor country or having more equal access to education or jobs for women does not necessarily mean more equal smoking behaviors. So, and when we dug into these cultural contexts, using religion as a proxy for shared cultural norms, we found that countries where dominant religion was Buddhism, Orthodox, or Sunni Islam, the gender differences in smoking intensity were smaller compared to Catholic majority countries, which we used as our reference group. So, but even what was even more telling for us were the interactions. So when we interacted cultural factors with religion, we found that, for instance, Buddhist majority countries in East Asia and Sunni Muslim majority countries in Europe and Central Asia, and also the MENA region, the Middle East and North America, they did exhibit like very unique patterns in smoking behavior that really differed with like other countries within such regions. So overall, our main finding indicate that cultural factors are more closely associated with variations in cigarette smoking intensity than economic factors. And so before I even like tease out some of the policy implications of these key findings, I just want to defer back to Mehedi so he can share some of the caveats that we put down in interpreting these study findings. Mehedi.
Yeah, thanks, Tina. And the next slide. Yeah. So as a strength of this study, I have to mention that we have compiled the most comprehensive real-world data set of gender disaggregated smoking intensity estimates across countries as yet available. And this covers over, again, to mention that 97% of the world population and at least 89% population from each of the 7 regions. Here, we are glad to announce that we will make this dataset open access with the publication of this study, which is under review with a journal. Therefore, this dataset will allow researchers to explore diverse topics in gender tobacco control research across countries. And along with these strengths, we have limitations too. Our cigarette consumption estimates are necessarily estimated from self-reported survey data, which could introduce differential reporting biases between men and women. Also, the age brackets and sample sizes in our dataset varied across countries, which could affect international comparability. Moreover, our cross-sectional dataset provides smoking intensity data for distinct years between 2000 and 2022 for different countries. So this requires some degrees of precautions in interpreting an estimate that pertains to a specific year. So I stop there. It's over to you, Tina. Thanks.
Thank you so much, Mehedi. I really appreciate for giving us that caution. So from a policy standpoint, we want to just understand what these findings mean for tobacco control. So first, it tells us that the one-size-fits-all approach won't really work because it will not really address the homogeneity in the smoking patterns that we have seen across populations, across regions, and also different countries. For example, regions like South Asia and the Middle East, where the gender smoking intensity gap is largest, these would require culturally sensitive interventions that will acknowledge and also address these entrenched gender norms. And second, in countries where smoking intensity is nearly equal, like we saw in Sweden, in Guyana, and Chile, we don't want to assume, we shouldn't actually assume that equal consumption means equal use. Yeah, so I'll say in these countries, we should not actually assume that this near parity means that the differences actually are not important, because even if you consume the same amount, men and women, the harm is not the same. If you use epidemiological models, they will tell you that the differences in the harm that a woman who's consuming 2 cigarettes a day and a man who's consuming 2 cigarettes a day will not actually be the same. And this also it means that in different regions, these women, even if they are consuming the same as men, the access to support services, for example, cessation and whatnot, are not usually equal. So we want to ensure that the policies that we put up are going to allow current smokers, to have equal access. And beyond that, we have also put down some of the recommendations that, especially at this time where we are trying to reflect that this year is a second decade after the implementation of the FCDC, we want to ask ourselves what we are missing. And for us, we believe that the answer to this lies in looking and also probing beyond the prevalence. So, and for this study, we're actually proud that it does open doors for new research direction. And for this, we propose like 3 research areas for future research. The first is that future research should be able to should explore some of the cultural commonalities and social meanings that shape smoking in different regions and different countries separately for men and women. And we are of the view that qualitative methods can be able to provide very critical content for interpreting these country level differences. And second, we also want to recommend that there's need to invest in harmonized global surveillance that collects comparable sex and gender disaggregated data on tobacco use. Because as I mentioned earlier, these data are not haven't been very easy to access. And when we collect this data and there's a systematic surveillance for their collection, it will be easy for researchers like ourselves to better monitor the trends and tailor interventions on tobacco control. Third, we also recommend that it's important for us to track gender smoking intensity over time using longitudinal studies. This will allow us to understand the changing patterns and norms as norms, obviously, and policies evolve and also take hold. And in a nutshell, I want to say we need deeper and more nuanced kind of evidence to help tobacco control become not just effective, as we always say, but more equitable as we go forward. And so, as I close, I just want to reiterate and emphasize that gender differences in smoking intensity are real, they are significant, and they vary greatly across countries. So these differences are driven by regional and cultural factors than economic prosperity that we've maybe known in the past. And if we want to reduce smoking and also reduce the harms that it comes with, we need interventions that are going to help us to equitably and regionally adapt our interventions so that we can address the real drivers of these differences and also this behavior. And for those that are interested in building upon this work, as we have mentioned earlier, our data will soon be publicly available. And so you could use this data for both policy and research as we go forward. We are very pleased to share this research. Thank you so much for listening.
Okay. Well, thank you both Tina and Mehedi for a great presentation. Very timely with World No Tobacco Day coming up just this Saturday. And I'm biased, but I really like this study. The amount of data that has gone into it is impressive. I don't think we counted up the actual number of respondents that aggregated up actually formed the base of the study, but it definitely has to be in the millions. And working all that data together to produce a comprehensive global map of smoking intensity, and then going the extra step to look at factors that are associated with the differences between men's and women's behaviors. There's a lot to unpack. So with that, I will turn it over to questions. If you have one, please online, please do put it in the chat or raise your hand. I'd be happy to let you speak. And I'll also be going to anyone in the room if they have them. I do see a question in the chat, which I might start us out with. Thanking Tina and Mehedi for the presentation. Is there an analysis related to the age differences and differences between girls and boys, men and women? So I think the question is about age differences, if we were able to look at that at all.
Yeah, so in terms of age differences, our data actually was we truncated our data to focus mainly on the ages between 15 and above. One, because at the time, the data that we're using was not disaggregated by age, and we did not have the opportunity to really delve into the age patterns, but the data is that the adult smokers that we focused on. And I think in the coming studies that we have plans of really looking and disaggregating data for different countries by not only males and females, but also looking at the age disaggregations and how patterns look in that regard. So no, we have not looked specifically at the different age categories.
I see a question in the room.
Hi, Tina. Hi, Mehdi. Nice to see you here, and then wonderful presentation. So I think, Mehdi, I met you sometimes when you were passing through from the Dadala Institute to the other side. So of course, we'll meet you and have a discussion. So I have two questions or clarifications with this result. One is, for example, I'm taking India because I'm from India. So we have a GATS 1 in 2009-10, and then GATS 2 in the 2016-17 most probably. And also we had a STEPS survey from a couple of states in India. So the methodological question is how you actually kind of compile these data, and especially when we have a recent data and then there is an old data. So how you actually landed up in summarized data for one single country when you have multiple surveys. That is question number one. Second thing is, of course, I'm very happy to see that the cultural part is coming up as an important determinant or driver of this gender difference. And of course, I had one very preliminary study done at a community level where I studied only the smoking among the women and what are the reasons. And primarily the cultural reasons came out, which was like, I can actually share the paper later after the session because that is an interesting reading for me and for everyone. And of course, related to this, depending on the prevalence, I feel the intensity of the cigarette or the BD, including BD, may be different, because if there are a lot of people smoking, there is a people tend to smoke a large. The intensity may be higher. So whether there was any adjustment done for this. Similarly, I think Tina mentioned about something very cautioned statement on access to surveys. I feel whether there is any link between access to cessation or attempt to cessation linked with the intensity of smoking between men and women, that there is a difference. So these are the two questions, are the kind of comments related to this results. So are you planning to kind of do this kind of analysis in near future? Over to you, Tina and Mary.
Yeah, probably I can respond to a part of the question, especially the first question related to the data. For India, we have collected data for different kinds of surveys and from different sources for the same country. Say for India, as you were saying, we had data for GATS survey or the STEPS survey, but we had certain inclusion and exclusion criteria of from which survey we want to collect data. So from India, we had the data from both STEPS and GATS, but based on the specific criteria about the sample size, or whether the sample size is powered enough, or based on the non-response rate to the survey. We consider different other factors from which of the surveys we'll be considering for our data extraction from. So for India, yeah, so we definitely got the data from either STEPS or GATS based on fulfilling these criteria.
Okay.
And maybe just to add on, when we look at the different smoking tobacco products, for example, cigarettes and BDs and the others, for our study, I think the main question that we went for within these different surveys that we collected data from was the question on manufactured cigarettes, because the reason for that was that the data for other tobacco products is not very reliable, and it's asked in different sorts of ways, which is difficult to harmonize across different countries. So it wasn't going to be easy for us at the point with the state of the data that is available to compile comparable kind of patterns for different tobacco products. I think, as you say, this is a very important aspect for us to look into. But I think until the way as we have highlighted in our recommendations, until we have data that is really harmonized and is reliable and comparable, it's very difficult to compare the different patterns in different tobacco products. So yeah, that's what I would say. I don't know, maybe I missed partly the question on differences in smoking intensity.
Well, I was going to say maybe I can address one aspect as well on the association between prevalence and intensity. You suggested that smoking intensity might go up with prevalence, but actually generally we find the opposite. It's almost let's say, a parabolic curve where you have a few heavy users as a percentage of overall smokers, and a long tail of people who use less and less going down to a minimal amount. And so actually we see extreme values of smoking intensity and smoking intensity ratio, especially in countries with lower prevalence, because it might be skewed by, say, among the few that smoke, they smoke quite a lot, or they smoke a little bit, and so we get more extreme values. We haven't quite figured out a grand theory of what is behind all of this in every country in the world, but I think it's something we need to look into some more in future studies, as you say. Yeah. I do see another question in the chat. Thank you, Zara. Thanking again for the presentation and wondering about the lab steps now that the study is published. Is there an interest in looking into context-specific factors, and what would that involve?
Thank you. That's a great question. So I think at the lab, we are very fascinated about really getting to understand the different perspectives of the tobacco smoking behavior across countries. And right now, we are actually looking at countries like region-specific factors just to understand exactly what is going around in these regions. So we have studies that are focused on the European region, for instance, just to understand exactly what is driving the different smoking patterns in these different regions. And we also have one study that is coming up in the Eastern and Southern African region. So we just want to understand, for example, how prices and tobacco industries interference has been influencing tobacco consumption in these regions. So the interest is there to really look at not just intensity, but also factors that are especially driving these patterns that are not just static, but also evolving. And beyond that, I think it's very important for us to use or tend to like interdisciplinarity to see what other for example, methodologies in terms of maybe social or anthropological, and also like qualitative kind of studies that can give us like the full meaning of what is going on in these regions and what exactly is driving the differences in smoking or the implementation of smoking tobacco control policies. Yeah.
And maybe I'll even give a quick shout out to Latika Lagwaran, who is doing her PhD currently on gender differences in tobacco use in the South Asia region. I know that she'll be looking into this question specifically as well. Other questions? And please do raise a hand online if you'd like to ask it in voice.
And maybe just to add,
Tina first, and then I'll go over to Michael.
oh yeah, I just wanted to add to that question to say, I don't know if we mentioned at the very beginning of this webinar, there's a new study that has actually just been published today where we were looking at understanding how gender has been integrated in different research that is looking at tobacco control. So this is just one way we are trying to understand how research can best inform policy in what is going on in tobacco control. And we think this is a very important contribution to the tobacco control fight at the moment.
Just quickly, there's a lot of emphasis on the gender differences, but your result seems to suggest that the differences are really more pronounced on other variables. So, for example, the cultural variables. So, I was wondering, whether you set out to discover differences between gender in terms of consumption, and then the conclusions seem to be pointing in a different direction. influence of cultural norms seem to be playing a more has stronger influence compared to gender differences. And I was wondering whether you could comment on that.
Thank you so much. I really like that question. So I think when we say in our results the wealth and gender inequity that we tested did not show significance in influencing the gender differences in smoking intensity. For us, the interpretation is actually pretty much different, because in our model, when we tested the drivers of tobacco, of smoking intensity, the variables that we used for gender inequity were like the mean years of schooling. So the equalness in education attainment, for example, for men and women. And also we used another variable that we were trying to show how the ratio between women's ability to get jobs. So in the interpretation of this, I think when you see what goes into these variables, it does not really reflect the cultural underpinnings that are embedded in these regions. And so when we used religion as a proxy for gender differences, for us, this reaffirms how important gender actually is. Because when you look at regions like South Asia, where the differences in smoking intensity were vast, and you look at religions in the sense of cultural social norms, we see that gender plays a very, very important role in this sense. And we actually think that our interpretation is that gender norms, of course, we can't really pinpoint to say this is exactly what these social meanings are, but it is a very, very important driver in the differences between how much men and women are smoking. So I think for us, it's the actual variable that we use in testing our model in this sense.
Yeah, and I might even emphasize that point, which is, I think, easy to say, okay, those are the findings and move on, but just how counterintuitive they really are. Because I've seen many studies cite without a reference really that in societies that are more gender equal, there's more equal consumption of cigarettes, and that's just out there as a commonly accepted fact. But we've actually done the work of compiling all the data and looking at these associations. And when you account for region, cultural difference, there's not a significant association between gender equality in a society and equality of cigarette consumption among current smokers. And similarly surprising, it's not just a rich country phenomenon or a poor country phenomenon. That's not really driving it either. So I think it's kind of surprising that both of these variables were not significant predictors of these differences.
Yeah.
So in a follow-up, so I'm just wondering, because of the limited time, you must have been presented only the core results. So whether there is any kind of additional results on changing trend of intensity in the countries or a group of countries, like for example in North America, I understand that surveys are regularly conducted. Even for India, there is at least 2 or 3 different time point we have surveys. So whether there is any kind of changing trend observed, whether it is part of this study, or are you planning to kind of do that in the future?
Yeah, probably I can go with the response to this question. And yeah, our data is cross-sectional. So this study particularly is very specific about the cigarette consumption and smoking intensity difference for men and women, that's for a particular year. But for other several studies that we are, other studies we are conducting currently, that also that will, in future will see how the cigarette consumption trends between men and women changes over the years for any specific countries, say for India. So yeah, we are currently doing the studies and hope to present this in the future. Yeah.
To be determined, keep an eye on this work. This is, it's an exciting area of research because we have the study out this morning saying we need more research in the space. This study is about to come out saying, okay, we've got these smoking intensity estimates for the first time. We're going to have the longitudinal cigarette consumption estimates that are coming out next. And after that, we're looking at the Framework Convention on Tobacco Control. Tina, you might even maybe give us some details on what we might expect with that analysis.
Yeah, I think even just to emphasize, I think in the recommendations of this study, what is important is for us to be able to collect data across these countries where we are able to ask the question how much you smoke, and these data should be collected consistently. I think the one problem that we really hit as we were collecting this data to compare the intensities was that it's a bit difficult for us to find across countries, across multiple years, how this question or these surveys are conducted in these countries. And it's just a lot of work and also quite difficult for us to navigate this. And beyond this, I think we are also, like as Matthew said, we are working on an evaluation where we want to show exactly how the gender differences changes using multiple data sets. So we are using the IHME data, we are using our own data at the international consumption, cigarette consumption, and we are also using these same data sets for which we have prepared this study. So I think at the end of the day, our plan is to ensure that we can show a global picture where smoking intensity, but also like the smoking itself is changing between across years from 2000 to date. We are hoping this is going to be ready maybe by the end of the year, but we are really optimistic that this is going to be like one of the very first studies that shows the disaggregated patterns in smoking for men and women over such an extended period of time. We are pretty excited for this, and the Global Strategy Lab has been putting in a lot of effort, and this will really change the way we look at tobacco consumption, but also how we inform policy as we adapt the different policies to ensure that we tackle and address the actual drivers of the differences and the behavior.
I just have a quick follow-up to my comments earlier on, whether it might be useful to focus on, with respect to differences and influence, whether it might be useful to focus on cultural influence. So, for example, the religion, education, and things like this, with respect to consumption or intensity, as you define it, as opposed to the focus on gender differences.
Okay, maybe if I could just say something quickly. I think that's like I totally agree with you. It's because cultural factors are really context specific. What this study does is to bring like this bird's eye view of what is happening across countries and across regions. And going forward, I think it's very important for us to really zoom into the particular cultural factors and social meanings and what these mean for like different behaviors, particularly in smoking. And I think doing this at the global level is really difficult because we're going to gloss over and just share averages. What we are recommending is for like researchers, it might not be us, could be other researchers who can really focus on really bringing out these social meanings that have been embedded in different cultural settings so that they inform and bring to the fore the different very nuanced evidence of why these meanings have this kind of influence and shape the smoking behavior. So it might not be us, but it's very imperative that we have to really interrogate and dig into some of these cultural norms and behaviors.
Absolutely. And I think that might actually be a good note to close on, unless there's any final burning questions. But I want to really emphasize just how important this work is, how timely, how relevant it is. World No Tobacco Day, there's so much more that needs to be done in this space. Thank you, Tina. Thank you, Mehedi, for an excellent presentation. And I also want to emphasize what I've seen in the chat, which is that we actually also have another webinar that the Global Strategy Lab is giving tomorrow in partnership with ASH Canada, the Global Alliance for Tobacco Control and Corporate Accountability, which is also an event for World No Tobacco Day. And we'll be focusing on the study that was released this morning. And I want to thank the Dadala Institute for hosting us today and everyone else for attending. Thanks everyone for your great questions, engagement, and I hope you all have a great rest of your day.
Thank you.
Thank you, everyone.